Hepatitis is a condition that causes inflammation of the liver, and it can be caused by several different viruses. The three most common types are hepatitis A, B, and C, each of which is spread in different ways and has different effects on the body. Hepatitis A is usually caused by eating food or drinking water contaminated with the hepatitis A virus. It can also spread through close contact with an infected person, especially in areas with poor sanitation. The symptoms of hepatitis A often include fatigue, nausea, abdominal pain, loss of appetite, and jaundice, which is a yellowing of the skin and eyes. The good news is that hepatitis A doesn't usually cause long-term liver damage, and most people recover fully within a few months. There's also a vaccine available that can prevent hepatitis A. Hepatitis B, on the other hand, is spread through contact with infected blood, semen, or other body fluids. This can happen through unprotected sex, sharing needles, or from mother to child during childbirth. Hepatitis B can cause both acute and chronic infections. Acute hepatitis B causes symptoms similar to hepatitis A, but in some cases, it can lead to more severe liver damage. Chronic hepatitis B can persist for years, increasing the risk of cirrhosis, scarring of the liver, and liver cancer if left untreated. Fortunately, there is a vaccine to prevent hepatitis B, and antiviral medications can help manage the infection and reduce the risk of long-term liver damage. Hepatitis C is mostly spread through contact with infected blood, often through sharing needles or other equipment used for injecting drugs. It can also be transmitted through blood transfusions or organ transplants if proper screening wasn't done, although this is rare today. Hepatitis C often doesn't cause symptoms right away. So many people don't know they have it until they develop more severe liver issues years later. Over time, hepatitis C can lead to cirrhosis, liver failure, or liver cancer. There is no vaccine for hepatitis C, but the good news is that it's highly treatable with modern antiviral medications. Most people with hepatitis C can be cured with a course of treatment that lasts from a few weeks to a few months. Hepatitis A and B can be prevented with vaccines, but hepatitis C currently has no vaccine. If you think you may have been exposed to any form of hepatitis, or if you're experiencing symptoms like fatigue, abdominal pain, or jaundice, it's important to see a doctor for testing. Hepatitis can be managed and treated, especially with early detection. Good hygiene, safe practices regarding blood products, and safe sex practices can help reduce the risk of these infections. By preventing exposure, getting vaccinated, and seeking treatment when needed, many people can lead healthy lives, even if they have or have had hepatitis.